Hello, everyone, and welcome to the last session of day 2 of Kidney Action Week, Kidney Kitchen Q&A with renal or kidney dietitians. My name is Ryan Woolley, and I'm the Director of Public Education here at the American Kidney Fund. I'm also a registered dietitian, so I'm super excited for this session today. In this session, I'll be describing American Kidney Fund's Kidney Kitchen resource, which is our comprehensive nutrition-focused website dedicated to helping people with kidney disease understand healthy eating for their disease. And then we'll also have a live Q&A session with 2 renal dietitians to get answers to your kidney-friendly eating and nutrition questions. So I'll go ahead and introduce you to those 2 renal dietitians. We'll be joined by Maria Rodriguez. Maria is a Spanish-speaking renal dietitian living in San Juan, Puerto Rico. She has been working with patients on dialysis for the past 11 years and with patients with non-dialysis CKD in private practice for the past 7 years. She enjoys speaking about different renal nutrition topics to different audiences, patients, nurses, renal dietitians, nephrologists, and nephrology fellows. And most recently, she started to provide an online renal nutrition education program for patients with CKD and has created culturally adapted educational material on renal nutrition in Spanish for dietitians. Thanks for joining us, Maria.
Hello, nice to be here.
We are also joined by Aisling Whalen. Aisling is a registered dietitian and founder of Kidney Nutrition Clinic, a virtual practice specializing in nutrition for chronic kidney disease. In her own practice, Aisling teaches her clients to implement science-based nutrition strategies aimed at improving numerous health markers such as creatinine, urinary protein, phosphorus, blood sugar, and blood pressure, while also considering each client's lifestyle and preferences. She is the author of the 30-minute Renal Diet Cookbook and the 5-ingredient Renal Diet Cookbook. Thanks for joining us.
Thanks for having me. Happy to be here.
I want to encourage everyone joining to please type your questions and comments into the chat box. We'll try to get to as many of those as possible during the Q&A session of this talk. And now to start us off, I'm going to give you an overview of our Kidney Kitchen resource. So Kidney Kitchen is our nutrition-focused website with the information on the basics of cooking and healthy eating for kidney disease. We launched it back in May of 2019, and it's been growing ever since. Got tons of recipes on there and information for eating for your stage of kidney disease. Next slide. So we know that adjusting to kidney nutrition guidelines can be difficult and confusing, and it may change over time as your kidney disease progresses. And it can also feel restrictive, like you're being told not to eat certain things. So we created Kidney Kitchen to create a resource out there for people with kidney disease that was evidence-based. So we brought in a bunch of renal dietitians to help us build it. And we wanted to make it feel empowering to you so that you can feel like you can make positive food choices. And our hope with Kidney Kitchen is to help you put the joy back in eating and think about foods that you can eat rather than foods that you cannot eat. Next slide. So Kidney Kitchen is for people across all stages of kidney disease. We've got information in there specific to people in early stages of kidney disease, people in later stages, as well as those who are on dialysis and even post-transplant life. And it's also a resource for caregivers, family and friends, healthcare professionals, and we've got tons of delicious recipes, so anyone that loves to cook can find this as a helpful resource. Next slide. Kidney Kitchen has over 750 kidney-friendly recipes, which have all been reviewed by renal dietitians. And we've got a ton of downloadable guides for you in there with different information for eating well with kidney disease. These include trackers, infographic, grocery lists, and different information on different nutrients. We also have information on eating well for stages of kidney disease and a video library with cooking demos and educational videos. Next slide. All right, so I'm sure someone in the chat has already posted a link to Kidney Kitchen, but let's dive in and take a look at a few of the pages. Next slide. So here we've got our find recipes page. So on here, you can search for different keywords in the search bar at the top. And you can also filter on this page for different nutrients. So if you were told that you may need to lower your phosphorus or your potassium, you can search for recipes that have low amounts of those nutrients. You can also search for certain dietary requirements you may have, like vegetarian or a vegan diet. And you can search for meal type. So are you cooking breakfast, lunch, dinner, want to make a snack? You can search that way. And we also have different collections. So we've got some seasonal recipes in there, holiday recipes. So you can search for that filter as well. Next slide. On this page, we have information for eating for your stage of kidney disease. So as your kidney disease progresses, your kidney function starts to decline. So you may need to change or adapt what you're eating based on the stage of kidney disease that you have. So we've got information in there for stages 1 through 2 of kidney disease, stages 3 through 5 not on dialysis, information for people that are on dialysis, and then information for people who've received a transplant as well. You can click through all of those pages to learn more. Next slide. And then we also have a nutrient resources pages. So I'm sure if you have kidney disease, you may have heard words like phosphorus or potassium or protein thrown around, but maybe don't exactly know what that means, what foods may be high in those ingredients. So we've got pages on every type of nutrient that you may need to think about with kidney disease, so you can learn more about those specific nutrients. Next slide. And then lastly, our resource library. So in here we have a ton of guides that you can click through and learn more about specific areas of kidney disease and nutrition, like this guide here, Dine Out with Confidence. We've got different educational videos on different nutrients and whatnot, and also cooking demos. So if you love to watch how to make a certain recipe, you can dig through some of those videos as well. Next slide. All right, so managing kidney disease needs to be unique to you, and it's typically based on what stage of kidney disease you have and your labs and your overall health. So that's why it's important to speak with your doctor and work with a dietitian to learn how to tailor your eating plan. Next slide. So the role of a dietitian. So you may hear them as a registered dietitian nutritionist, or just dietitian. And these are food and nutrition experts. They have specific training, or we, I should say, have specific training in helping people tailor their food plan based on their health condition and their preferences, and making sure that you can find information in food that you're really going to enjoy and not feel like you just can't eat things. And then there's also, so all dietitians are trained on helping to create a kidney-friendly food and fluid plan. But then there's also renal dietitians who go through extra training to learn more about kidney disease and tailoring food and fluid plans for kidney disease. So you can also work with a renal dietitian. And we have a guide for you called Getting Ready for Your First Dietitian Visit When You Have Chronic Kidney Disease, featured here. And this just gives you some information about what it's like to work with a dietitian, how to prepare for that visit, where to find a dietitian. And on our Kidney Kitchen website, we also have a tool to find a dietitian. So in there, you can search by your zip code. You can even search for specialty. So you would maybe search for renal or kidney and be able to find a dietitian in your area that you could work with. There's also dietitians who work over telehealth too. So if there's one in your area, you may be able to find some through that searcher that works for telehealth. All right, next slide. All right, now we have a ton of time for our Q&A with our two renal dietitians. So hopefully you've been racking in some questions. And if you please feel free to drop any questions that you may have at any time throughout this chat, and we'll try to get to as many as possible. All right, so the first one that came in: can a plant-based diet actually improve kidney function? If so, what diet changes are essential? And Aisling, I'll pass this first one to you, and then we'll kind of go back and forth.
Sure. Yeah. So the question was, I'll answer the first part of it first. Can a plant-based diet, was it help kidney function? Is that what it was?
Yeah, improve kidney function.
Improve kidney function. Yeah. So a plant-based diet can actually be really beneficial for people when they're dealing with kidney disease. And it can be beneficial because of several factors. When you eat a plant-based diet, you tend to eat a lot of fruits and vegetables. And fruits and vegetables are really beneficial for people with kidney disease because they contain a lot of anti-inflammatory compounds. And we know that kidney disease is a chronic progressive disease. So it's associated with a lot of inflammation. So when you eat a lot of anti-inflammatory foods, it can be helpful for addressing that part of the disease. Another thing that fruits and vegetables have is a lot of fiber. And you can find fiber in not just fruits and vegetables, but other plant foods like whole grains and nuts and seeds and legumes. And we know that people with kidney disease, they tend to have a gut microbiome, which is kind of like the bacteria that live in our gut, that can be a little bit more inflammatory as well. And so we want to help improve the gut by actually eating foods that are going to help promote the good and friendly bacteria. And so when you eat lots of foods that contain fiber, like those foods that I just mentioned, you're going to help support those really healthy bacterial strains. And that can make someone with chronic kidney disease generally have better outcomes. So that's kind of, a couple of the reasons why a plant-based diet is really helpful. And then another reason is that a lot of times people with kidney disease need to reduce their overall protein intake because the kidneys are responsible for processing protein. And so if you're following a higher protein diet, that can just make your kidneys work a little bit too hard. And the nice thing about a plant-based diet is that it's naturally going to be lower in protein than more of like an omnivore type diet that contains a lot of flesh proteins, such as meat or poultry. And so when you switch to more plant proteins, you tend to just kind of reduce that workload of the kidneys, and that can be very helpful.
Thank you.
Was there another part of that question? And I'm not sure if I answered it.
The other part was what diet changes are essential.
Oh, what diet? Okay, so if I was to say the most essential thing to think about when you're following a plant-based diet, it is to ensure that you're eating wholesome plant foods. So wholesome plant foods are going to be things that are, naturally found in nature, as opposed to these sort of plant foods that you'll often find in like the vegetarian section of the grocery store, which are not always, terrible, but sometimes they're very processed, and because of that processed nature, they tend to have a lot of sodium or additives such as phosphates. So if you stick to wholesome plant foods like, whole fruits, vegetables, whole grains, nuts, seeds, legumes, olive oil, then you're really going to get, the benefits of those plant foods without having to worry about some of the less healthy attributes of these processed plant food items.
Great, thank you. Maria, I'll pass this next question to you. Is the Mediterranean or DASH diet better for CKD? And maybe you could explain what each of those diets are.
So a Mediterranean diet is mainly plant-based. So what Aslin was saying, whole grains, fruits, vegetables. It includes nuts, seeds. It includes legumes or beans and olive oil. Usually olive oil is a staple in the Mediterranean diet. And it does include sometimes some animal proteins, but it usually advises on reducing the frequency and the amounts you eat them during the week. So it's going to be lower in those red meats and processed foods and added sugars, which obviously all of that can definitely be good for stages, either early kidney disease, and I would say also for people that are already on dialysis and also post transplant. So what we have to think about is if you need a potassium restriction, then we have to adjust the Mediterranean diet so it's lower in potassium, and then be aware of those added phosphates. So that's what I would add to the Mediterranean diet eating pattern. And the DASH diet is usually a low sodium diet and a high potassium diet, mainly from fruits and vegetables. So usually a DASH diet may have between 8 to 12 servings of fruits and vegetables a day, which is good for kidney disease. So the only thing I would add also is the same thing I said before. If you have a potassium restrictions, then we limit the total potassium, and then those added phosphates. But yes, a low sodium diet is good for CKD any stage.
Great, thank you. All right, next question. Are there meal delivery services that serve kidney-friendly meals?
So this is a great question, and it's something that I'm always on the lookout for. There are definitely kidney-friendly meal delivery options, but it can be tricky sometimes because depending on someone's stage, their needs can differ. So I find that for the dialysis population, there are a lot of options available. But for people who are maybe trying to follow like more of a plant-based diet, and they're dealing with kidney disease, sometimes it can be hard because while there's plenty of plant-based meal delivery options, many of them are very high in sodium. So that's just something that you have to kind of navigate, is making sure that the recipe is not too salty. And then the other thing to think about is if you are dealing with some kind of a potassium restriction, sometimes it's not listed like how much potassium is in the meal, so it can be hard to control that. But oftentimes with the help of a renal dietitian, you can find options that would work for you. And going back to what I said about the dialysis population, there's definitely meals available that are potassium restricted, sodium restricted, and the reason why I don't always find that they work so well for people with earlier stages is I find that they tend to be quite high in protein. So I don't necessarily always recommend them. But again, with some modifications and help from a renal dietitian, we can talk about adjusting portions and things like that to make them work for a person with any stage.
Thank you. Maria, could you provide suggestions for managing type 1 diabetes with CKD stage 3, or maybe just generally diabetes and kidney disease?
Great question. So when we think of managing diabetes, we want to include complex carbohydrates. So if you're eating whole foods like oatmeal, whole wheat bread, pastas or rice, you can choose them whole wheat or brown rice. So you want to still include those whole grains because of the fiber. Fiber is really important to manage blood sugars and also to keep the kidneys healthy. So it will work for both things. So thinking of how you're distributing your carbohydrates during the day. You don't want to eat a lot of carbs at a certain meal. So when we are in stage 3, when you want to avoid excess protein, you don't want to eat excess carbs just to have your calories and your needs met. So healthy fats can be a great way to improve the calories that you need without excess carbohydrates or excess protein in your plate. So if you don't need a potassium restriction, avocado could be a good alternative. If not, you can use olive oil. You can use other olive oils like avocado oils, and even nuts and seeds can also be included as those healthy fats. So I think for diabetes, like thinking of diabetes while having CKD, make sure you're including your whole grains, your fruits and vegetables. Don't be afraid of eating fruit because of your blood sugars. Make sure that you're preferring the whole fruit instead of juice, because that will also help your blood sugar control. But don't be afraid of including fruits because it's important to protect your kidneys.
Great, thank you. We had a couple of questions about oxalates. So what can I eat that is plant-based for fiber but low in oxalates? So Ashley, if you could describe what oxalates are and then go into the question.
Yeah, so oxalates are a component that's found in plant foods, and most of us don't really need to worry so much about oxalates, but for some people who are dealing with kidney stones, like particularly calcium oxalate kidney stones, where they have a lot of oxalate in their urine, or in polycystic kidney disease, sometimes we need to limit oxalates as well. But they are found in most plant foods. But then certain plant foods are going to be much more concentrated in them. So, I generally don't recommend tracking oxalates because you'll go crazy doing it, because you're not going to find it on the food label. And, there's just a lot of conflicting information online about it. So what I usually recommend is that people just become aware of the foods that are really high in oxalate, and then really just work to limit or avoid those foods. So the very high oxalate foods that you'll want to be aware of if you're in need of a limitation in your diet are going to be things like spinach, and that's going to be cooked spinach or raw. Almonds are very high in oxalate, buckwheat, rhubarb, and navy beans and miso. So those are some of the high oxalate foods, and some of these foods are often not foods that people really eat that much of anyway. And for the ones that people do tend to eat a lot of, there's usually good swaps. So, for spinach, I usually recommend that people switch to kale or baby kale. Instead of almonds, I'll recommend like macadamia nuts, or you could do something like sunflower seeds or pecans. So there's usually a lot of different alternatives.
Great, thank you. Okay, Maria, this question says, I struggle with computing nutrition for individual servings when making a large dish with multiple servings. Is there a database to help figure out helpings?
Okay. So there's apps that you can download to your phone. And you can insert the recipe, like how the ingredient list. So let's say you were making, I don't know, chicken with some vegetables. So you can input the list of ingredients, and then you'll tell it how many servings will that recipe yield. So for example, if that recipe is for 4 servings, then you'll tell the app, okay, calculate the nutrition facts for 4 servings of this recipe, and then it will calculate. And then in the same app you can add it. So if you had that for lunch, for example, then you can say, okay, I had 1 serving of this recipe for lunch, and then that could help you tally your nutrition intakes, if that's something that you're tracking and it's helpful for you.
Great, thank you. Next question, how much do you rely on blood tests in making your kidney-friendly eating recommendations, and how frequently should tests be done?
Good question. I would say I do rely on blood tests a lot when I'm trying to come up with a kidney-friendly diet for somebody. I wouldn't say it's everything in how I decide and think about what an ideal diet will be for somebody. Certainly I'll consider other things like culture and how somebody likes to eat, their lifestyle, whether they like to cook. But certainly the labs can guide me in deciding, what kinds of things need to be emphasized and what might need to be limited. For instance, when I'm looking at protein and how much protein someone should be having, the GFR can be helpful. because if somebody has, a very low GFR, then they're not going to be able to handle as much protein as someone who's got a higher GFR and still has a decent amount of kidney function. I also look at the potassium level. If I see consistent potassium that is, borderline elevated or elevated, well, then that's going to make me think that perhaps we might need to be limiting the potassium content of the diet. And then, other things that I might look at on blood tests would be someone's bicarbonate level. So I'll check the CO2. And if I notice that's consistently on the low side, I'm going to be really striving for, telling that patient to have more fruits and vegetables in their diet, because I know that the alkaline content of those foods is going to help to improve that marker and help them to be less acidic. So there's lots of things that I look at in the blood to determine, some dietary recommendations. And then usually I like to have people consult with me when they get their blood work. So, I'll usually recommend a follow-up, around the time they follow up with their nephrologist and get their blood work. And that way, after they consult with their nephrologist and, discuss any changes that need to be made on the medical side, we can then look at the blood work and decide if there are any changes that need to be done, on the food and lifestyle side to just kind of keep the needle moving towards meeting the patient's health goals.
Great, thank you. Maria, next question for you. Would increasing water intake help improve kidney function?
So, as many things in the diet, we don't want too low, but sometimes excess can also be harmful. So when we're thinking about early stages of CKD, we're thinking between 2 to 3 liters of water a day. Some people might need restrictions if they're like later stages of kidney disease, or if they have heart problems, or they have been told by their doctor that they need to restrict. And in those people, then you will follow what the doctor is telling you. For dialysis patients, it's usually a restriction depending on how much urine they are making. So it's important that that we make the difference between stages, because sometimes people look in the internet and maybe they can read different information about fluids, and it's important that yes, in early stages water is important, enough fluids is important, but maybe when you are in hemodialysis, maybe then you'll need a restriction. Maybe if you're in PD, you don't have to restrict as much. So depending also in what type of therapy you are for dialysis, it also may vary.
Thank you. Here's a question for you, Ashley. I was told avocados were high in potassium, which is not good on a renal diet. Any thoughts?
So it's true. Avocados are high in potassium, but whether or not they're, good on a renal diet really depends on whether, you need to follow a lower potassium diet. And so, traditionally people who were diagnosed with chronic kidney disease were kind of told across the board to just limit high potassium foods. And, this is not always really necessary, because typically, like in the earlier stages of chronic kidney disease, like even up to stage 3, later stage 3, oftentimes the kidney function is still good enough to actually get rid of any extra potassium in the body. And so we don't see this issue with high potassium in the blood. And oftentimes during this stage as well, we're really trying to keep blood pressure well controlled. And we know that potassium is very helpful for doing that. So it's often not indicated, and then can sometimes even be detrimental to over restrict potassium when these circumstances are present. But however, if somebody is on certain medications or They're just dealing with a later stage chronic kidney disease, and their potassium level is trending high, consistently. Well, then, sometimes they do need to limit the potassium content of their diet. But even still, it doesn't necessarily mean avocados are bad and they need to be limited entirely from the diet. It just means that, this is a food that you may need to be a little bit more cautious about in terms of the portion. And so, if you're on a lower potassium diet and you eat an entire avocado, that might be too much potassium for your body to handle. But if you sort of look at avocado as, okay, this is something that I can have, but I need to be conscious about the portion, well, then, maybe you just have like a quarter of the avocado, and then you make sure that at that meal, you're not having any other very high potassium food. So that's kind of the way I go about it, because it sort of allows people to still include some of these foods in their diet without having to be completely restrictive.
Great, thank you. Next question here. Are there any foods or meds that can get rid of a bad gut microbiome in people with kidney disease?
So get rid of a bad microbiome. So I think diet is important. So I would start with that, with eating enough fiber and gradually increasing your fiber also, because if you from one day to the other increase your fiber intake significantly, your body will maybe resent it. So when you're thinking of adding fiber, those whole grains, fruits, vegetables, nuts, seeds, legumes, make sure to add them gradually. So you gradually want to get to those maybe 20, 30 grams of fiber a day. When we're thinking of medications, I might think maybe of probiotics, naturally occurring on fermented foods, like maybe yogurt, like a plain unsweetened yogurt, or maybe other fermented foods. Maybe some fermented vegetables, or maybe tempeh, which is also fermented. So those could be good ideas to add into your diet for that probiotics. And maybe talk to your doctor or to your dietitian to see what kinds of probiotics as a supplement you may add. But I would consult that with your team.
Got it. Thank you. Aisling, we have a question here about how effective is telehealth for someone who maybe doesn't have renal dietitians that live in their area?
That's a really good question. And, I think the pandemic actually really helped us to see that telehealth can work, just as well, oftentimes, to, help people with their health issues, without necessarily being in the same room, but, virtually working with someone can still be very helpful. In my practice, it's all telehealth, actually. And, prior to doing telehealth, I did see patients in office. But one of the things I've actually noticed that I prefer about telehealth is that during a consultation, we're often talking about, the food that they're eating on a regular basis. And sometimes, we need to kind of clarify, well, what brand are you using, or how much sodium is in that? And they can just quickly run into their kitchen and grab it and put it at the camera, and we can talk about it. And so that was something that we weren't able to do before telehealth. So in my experience, nutrition counseling done through telehealth can be just as effective as consultations in person.
Thank you. Maria, could you share some kidney-friendly snack ideas?
Sure. So always fruit could be a great idea. You can pair it maybe with unsalted nuts, or maybe with that plain yogurt I was talking about before. I think low sodium popcorn is also a great alternative. Many people get surprised that popcorn can be healthy because I think they're thinking about that movie theater popcorn. But yes, you can make your own popcorn, low sodium, at home, and that could be a great snack. You can also think about maybe hummus, which is a plant-based snack made with chickpeas, and you can maybe have it with maybe baby carrots or maybe some peppers, or even like a low sodium corn chips. That could be a snack too. Chia pudding is a really fun snack because you can alter the different fruits you add to it or the different flavors. So it's also really high in fiber. If you are having to follow a lower protein diet, then you can do it with maybe a plant-based milk that doesn't have added phosphates. You can add the chia, and then you can add maybe some berries or any other flavors that you like. Any other ideas, Asling?
Yeah, I think those are really great options. I think, the fresh fruits and vegetables are always ideal. But sometimes I guess, people want like a convenient snack to kind of have in a package. So I always say if you're not going to do like the fresh fruits and vegetables and you're going to go for like a packaged snack, you just want to think about, some of the important things to consider on a label. So, you'll always want to make sure that the sodium content is not too high on a packaged snack. So I always recommend like no more than about 200 for a snack serving. Also check out the sugar because we don't want to have too much sugar. That's going to promote inflammation. And so usually, I would recommend like looking at the added sugar and just keeping in mind that for every like 4 grams, you're getting about a teaspoon of sugar. So just watch for that so it doesn't get too high. And then, of course, the fiber as well. So snacks can be a great way to add fiber, as Maria was saying. So, look at the fiber content. Ideally, it's going to have at least about 2 grams. And finally, I would just look at those ingredients, right? So you want to make sure that the ingredients are whole foods, not highly processed, and that they're, foods that are going to contribute to your overall healthy diet.
Great, thank you both. Our next question here, I understand Medicare does help cover costs for a dietitian. Do I need a referral from my doctor?
Yes, I can answer that. I bill insurance. So yes, Medicare will ask you for a referral. And also, if you usually the first year you're diagnosed, Medicare will cover 3 hours of medical nutrition therapy. But if your doctor gives you an extra referral, we can bill additional units for medical nutrition therapy. After your first year, then you'll get 2 hours every other year. But as well, if you get an additional referral, then we can bill probably more units.
Great, thank you. Let's see here. What are the best fluids to help kidneys, and can you have alcohol?
So as far as like the best fluids, I would say, water is going to be ideal. Certainly other fluids can be part of a healthy kidney-friendly diet. I love like unsweetened tea, even coffee can be part of a healthy diet. And then, you just want to be kind of careful with things like juices, sweetened beverages, and then, of course, beverages that have like phosphorus additives in them. So you'll sometimes see that as like phosphoric acid. For instance, you'll see that in some of the dark sodas. And so what was the last part of that question, Ryan?
The last part is, can you have alcohol?
Oh, can you have alcohol? Okay, so that's a good question. And, it really depends. I mean, I tend to defer to the doctor on that question. But if your doctor is okay with it, like I'm okay with, just sort of, modest use of alcohol. For men, that would be no more than 2 drinks a day. And for women, that would be about 1 drink per day. So usually that's what I would recommend.
Thank you. In the absence of diabetes or high blood pressure, how likely is it that a kidney-friendly diet may actually stop the progression of kidney disease in early stages?
Well, we have to see the cause because different causes, and I'm thinking about maybe PKD or some kind of disease that you're expelling a lot of protein in your urine. So we have to know I like to know the cause of kidney disease to see what type of modifications diet can actually help with. I believe, yes, it could delay the progression of the disease. But I think it's really important to have the diagnosis so a kidney dietitian can make those precise recommendations in that case. But yes, I think it's possible.
Thank you. Next question here. How much protein per day should a kidney transplant patient have?
So if I'm not mistaken, I don't actually work with the transplant population as frequently, but I believe, and you can correct me, Maria, here, I believe the protein recommendations are the same for the general population. So there's not like a recommended protein reduction. However, I would usually recommend that somebody who's post-transplant would avoid like high protein diets. So for the general population, the recommended protein intake is 0.8 grams of protein per kilogram. And for the older population, sometimes this is increased just to preserve muscle mass. So yeah, so just a general, sort of healthy amount of protein would be recommended.
Thank you. And Maria, next question here. Are artificial sweeteners like Splenda okay to use?
I would say yes. I also encourage people to use the minimum amount they need. Just because artificial flavors are usually very, very sweet, and maybe we get used to that very sweet flavor. And I really want people to enjoy the natural sweetness of foods like fruits. So yes, you can use it, but if you can, try to use just the minimum amount that you need.
Great, thank you. Let's see. Ashley, sorry, I lost my place here. Next question here is how can you eat low sodium while eating out?
Good question. Because when you're eating out, it can be tricky since oftentimes the meals that you get at a restaurant are going to be a lot higher in sodium compared to the foods that you're going to cook at home. So there's several things you can do. One thing is you can enlist the help of your server because they're very familiar with the menu, and they oftentimes, have many customers who have the same requests. So you can ask the server if they can guide you towards some of the lower sodium options. Or you could ask for their help in modifying some of the menu options. So, for example, when you're thinking about some of the options that might be very high in sodium, you need to be thinking about, well, what ingredients tend to kind of add a lot of sodium to a meal. And that's going to usually be things like bread, sauces, particularly soy sauce, cheese. These are all going to really ramp up the sodium. So you can ask for things like having the sauce prepared on the side. You can ask for, less cheese or no cheese. You can say, instead of having bread, I might just do a salad instead, or get some fresh, like roasted vegetables. So these are things you can do to kind of limit the total sodium content. And then the other really important thing to consider is that in restaurants, the portions tend to be very large. Oftentimes they're going to give you like 2 to 3 times a regular serving. And so even if you're choosing a menu option that's not like, it doesn't seem like it's very high in sodium, simply because you're just eating so much of it, the sodium can add up. So, you can share your entree with somebody, or you can, bring some of it home and have it the next day. And this can help to reduce the total sodium content.
Thank you. Maria, looks like you have a follow-up on the sweetener question from before. Do you discourage or encourage using honey as a sweetener?
So I think it's the same for me. Thinking about the Splenda versus the honey. If you're gonna use honey, you can use it, but try to use the smallest amount that you need. So I think that comes to like your preference. Maybe some people won't like the aftertaste of some artificial sweeteners, and they may prefer using or honey or agave or maybe sugar. It's all still simple carbohydrates. Okay, we call them sometimes empty calories because nutrition wise we don't need them, and it's just adding plain simple carbohydrates and just not much nutrition. So if you want to sweeten something, you can use honey, but the same, try to use the minimum amount that you need.
Great, thank you.
Do you want to say your perspective, Aisling?
No, I think you kind of summed it right up. I would really say the same thing, is just to kind of limit the total amount of sweetener that you use, because it can just sort of add up quickly, and it's good to try to train our taste buds not to need so much sweetness at every meal.
Thank you. Could you share how a caregiver who maybe shops for and provides the food or makes the food for someone with kidney disease, any strategies for caregivers?
Yeah, great question, Ryan, because, being a caregiver can just add a lot of responsibility. When you're trying to plan meals and snacks that are going to be suited, for the person you're caring for, and then also oftentimes for the whole family as well. So my biggest recommendation would be really to plan ahead as much as you can. And so, it's a good idea to maybe plan for a day where you have some time to think about, what are the meals that you'd like to prepare for the following week. So you can think about, breakfast and lunch and dinner, and just decide on, the kinds of things that you think are going to work well for your schedule and for your taste preferences in the week coming up. And then you can think about, some recipes, or, maybe you're not going to use a recipe, you just kind of have some ideas. Kidney Kitchen is a great resource. You can check it out and look for some inspiration there if you're not really sure what you want to make. But once you kind of have that framework of the kinds of meals that you plan to have, well, then you can create a list, and you can go to the store with that list and get what's on the list, and it can just make it much easier than sort of going to the store where you're just sort of bombarded with all of these options, that it can kind of become overwhelming. And, oftentimes people, when they do that, they end up buying a lot more than they need, or they end up, forgetting certain things that are essential for what they end up needing. So I definitely think planning ahead can be really helpful. And, when you are preparing meals, if you're not someone that likes to eat a lot of leftovers, what can be a good idea sometimes is actually just to freeze some of the leftovers that you have, and then you kind of start to have somewhat of a stockpile in your freezer for times when you don't necessarily have time to cook, but you have that kidney friendly meal that you maybe made a couple of weeks ago that you can heat up for your family.
Great. And labeling it is important. I always find things in my freezer that I've frozen from months ago.
Yes.
And I forget what it is.
Yes, that's a really good point. Yeah, make sure you have a label ready so that you know what you froze.
Okay, next question here, Maria. Could you talk about the things to look for on a food label and how to do that?
Sure. So first thing you want to look is the serving size, because everything under that label is going to be related to that specific serving size. And depending on the food that you're looking, the serving size will vary. So maybe it's in cups, maybe it's in ounces, maybe it's in amounts like chips, maybe it's 7 chips or 5 crackers. So just make sure you understand what are we talking about. Then I would go to sodium, as Aslin was saying, look at the sodium amount. By definition, low sodium is 140 milligrams or less, but that doesn't mean that if something is a little bit higher, that you automatically have to avoid it. So I always say between 140 and 200 might be okay. If it's over 200, just make sure to see and compare if there's another similar alternative that is a little bit lower in sodium, or if you can adjust the amount. For example, dressings, maybe a dressing can say 2 tablespoons and maybe 220 milligrams of sodium, but you really like that one. And then we can say, well, instead of eating those 2 tablespoons, you can just eat 1 tablespoon, and that way you're reducing the amount of sodium by just lowering the amount that you're serving yourself. So sodium amount. Then I would look at that carbohydrate distribution. I would want to see that if it's a food that naturally has fiber, that it has some fiber, maybe 2-3 grams of fiber, and then that is lower in added sugars. So as Aslin was saying, every 4 grams of added sugar equals a teaspoon. And there's some general recommendations, but the American Heart Association says that females should be in a day eating less than 6 teaspoons of sugar a day, added sugars a day, and men less than 9. So if you can be below that, that would be great. And some other recommendations say just stay below the 10% of your daily calories. So for example, if you need 2,000 calories a day, then that would be less than 200 calories from added sugar. So those are like the main general recommendations when we're talking about how much sugar should we eating. But even healthy folks shouldn't be eating a lot of sugar. So just be aware and mindful of where that added sugar is coming from, and try to look alternatives of lower added sugar options. And then I would go onto the ingredient list. So make sure that there are no added phosphates. So if the label is in English, it will say phosphoric or phosphate, which is PHOS. If the label is in Spanish, then is FOS, which is FOS. So just look at that in your ingredient list. And then if you need a potassium restriction, the newer guidelines KDIGO 2024 that came out this past week talk about the absorption of potassium depending on the bioavailability. So added potassium, those potassium additives are similar to the phosphate additives, which the body absorbs in a higher proportion. So it's smart, if you need a potassium restriction, to look for potassium chloride, especially because that is added to many foods to maintain the sodium content low. Because if you've seen the salt substitutes, the main ingredient is potassium chloride, and that ingredient is also added to other products. So we're telling you to look for low sodium alternatives, and maybe that potassium chloride might be in the ingredient list. So it could be a first step if you have if you need a potassium restriction to avoid those added phosphates.
Great, thank you so much. All right, we're getting close to the end, so I think we can squeeze in one last question here. This person is asking about processed plant-based sandwich slices, watching sodium and phosphates, but it's hard to avoid the simplicity and convenience.
Yeah, I hear that. I mean, sometimes you just need something convenient and quick. And so, you're not always going to be eating the perfect food, for your condition and for your health. I think it's really about, how often are these foods part of your diet? And if it's something that you just very occasionally have, I really wouldn't sweat it. You do always, if you can, try to just make sure that, you're looking at things like sodium and phosphates, and, if there's something that's a better option, then I would go with that. But, if not, and it's something that you really enjoy, I would just try to have it on a, less frequent basis, and, think about some of the more nourishing things you can choose for your other meals. I always tell patients you have like 21 meals in a week, right? So you have breakfast, lunch, and dinner every day for 7 days. That's 21 meals. If we can make even like 15 to 18 of those meals really good for you meals, then we don't have to get so hung up on those other few that weren't so great, because, they're not going to cancel out all the good you did for those other meals.
Great, thank you. All right, now as we wrap, I'm going to ask you each to share one thing to know and one thing to do for the audience to take away from this session. So Maria, I'll pass it off to you. Can you share one thing from today's session that you would like our audience to know and one thing to do?
I think I'm gonna talk to maybe from a Hispanic perspective, that your culture matters, and that you don't have to avoid your favorite culturally recipes, or those foods that are really important to you. So we can when you work with a dietitian, we can help you modify that recipe so it's lower in sodium, or look for swaps while having that same feel. Or we just can leave it the same and just add it, as Aslin was saying, maybe the frequency or the portion amount, then we change that. So know that when you work with a dietitian, we're not gonna erase all the foods that you love. We're really gonna try to include what you like. And I think most people don't eat enough fruits and vegetables. So try to eat enough fruits and vegetables every day. And if it's not perfect, as Aslin was saying, tomorrow is another day and another opportunity to get in those fruits and vegetables.
Great, thank you.
I love it. Great. So yeah, I think, one thing to know and take from this session is that, a kidney-friendly diet is a really important part of your strategy for, slowing down your CKD progression and just improving your overall health. And so it's important to find a way to implement that kidney-friendly diet. So, maybe it's enlisting the help of a renal dietitian, or it could be as simple as, going to that Kidney Kitchen website, doing some research yourself, and coming up with some meals that are going to be, your sort of go-to for your kidney-friendly diet. So, having that, breakfast or lunch or dinner option that you enjoy, but it's also good for your kidneys. So, that's something to know. And then as far as do, it's really just implementing that, that kidney-friendly diet. So once you get those recipes and you're inspired to try them, hopefully they can become part of your routine. And it's really that consistency that's going to have the biggest difference. So if you can just find those meals that are health promoting and kidney friendly, and you can, stick to that as part of your lifestyle, you're really going to see some positive results in your health.
Great. Well, thank you, Maria, and thank you, Aisling, for a wonderful session today and answering all of these nutrition and kidney eating questions. We really appreciate having you here. And thank you to our audience for tuning in and for all the questions you've shared today as well. This concludes our day 2 of Kidney Action Week. Come back tomorrow, March 20th, for our first session of the day at 10 a.m. Eastern Time, Kidney Disease through the Health Equity Lens, striving to bridge the gaps. As we conclude this session, you'll see a brief survey come up in the chat, so please take a minute to fill it out and tell us how we did today. Your feedback will be very useful as we plan future sessions. Thank you, everyone, and have a wonderful day.